Rating common over-the-counter supplements as a geriatric nurse practitioner. I'm coming out the gate strong with Prevagen, 1 out of 10. There is no convincing evidence that shows that it improves memory for normal aging or dementia. Glucosamine, 5 out of 10. There is mixed evidence of whether or not it is effective. Some people with osteoarthritis report that it helps, some people don't. There's no real good evidence either way, and it does not rebuild cartilage. Cinnamon, 3 out of 10. There is maybe some modest effect on blood sugars, but it is not a replacement for diabetic medication or lifestyle changes. CoQ10, I would give a 7 out of 10. There is some evidence that it helps in certain conditions, especially statin-induced myopathy or some heart conditions. Turmeric, 7 out of 10. There is some evidence that it helps with inflammation, decrease in pain scores for people with osteoarthritis. It does have common side effects of diarrhea. You need to use it with caution, especially if you're on a blood thinner. Also, bioavailability is an issue. Absorption is an issue. Fish oil, I would give a 7 out of 10, maybe 8 out of 10. There is strong evidence that it helps lower triglycerides. I cannot talk today. Triglycerides, especially if it is a prescription omega-3. The overall effect that it has on cholesterol and heart health is probably a little bit more nuanced, and there's mixed evidence as far as that goes. It's a good option if you don't eat fish regularly. Melatonin, I would give an 8 out of 10 if it is used appropriately or lower doses. I think people use too high of a dose. It can be helpful in a lot of sleep disorders, sleep rhythm disorders, as well as like people who are shift sleepers, jet lag. That's another good reason to use it. B12, I would give a 9 out of 10, especially if you have a deficiency. B12 is responsible for nerve communication and brain health. People who take PPIs, who have digestive issues, people with certain diets are